Hello guys, welcome to Medibytes. Now let's continue the second part of the menstruation. Now we have already discussed how fertilization takes place and then there is production of progesterone and estrogen in our body, right? So if there is no fertilization at all, then the corpus luteum would not be formed and it will cause the degeneration of this corpus luteum or yellow body. On what day? On 9th or 10th day, right? 9th or 10th day. This is an important question which is asked in exams. So in exams we will be given on 15th day as an option, right? So the total degeneration is on the 15th day, but it starts on 9th or the 10th day after no fertilization takes place. Okay, so now since there is degeneration of corpus luteum, there will be no progesterone formation furthermore, right? So the supply of progesterone will be cut. Now this will lead to the shedding of the endometrium, right? This will cause the shedding and we will have menstruation. Okay, this causes shedding of endometrium. Why does this takes place? It takes place due to withdrawal of progesterone. Okay, you have to remember this from this part, right? Because this is very important. Now let's talk about dysmenorrhea. Okay, so what causes our body to dilate the cervix, right? Because we know the cervix is very small, but when we menstruate, then there is a little dilation in the cervix which leads to the injection of the blood from the endometrium. Think if the cervix is always dilated, then there will be no formation of endometrium because the blood will keep falling, right? So to stop this, the cervix is not always dilated. So how does it dilate on the time of the menstrual cycle or on the day of menstruations? So there is a substance known as prostaglandin. You might have heard of this, right? Now what this prostaglandin does is, this is our uterus. Okay, this is our uterus. I did not got the hang of drawing it. So this is our uterus. This prostaglandin does the contraction of the uterine smooth muscles. Now what does happen next? So when there is the contraction of this will cause pain, right? Now due to this pain and due to this contraction, we have the dilation of cervix. Now this dilation causes the endometrium to shed and the shedded blood to fall. Okay, now due to this we know we experience a lot of pain or cramps, right? This pain and cramps are known as dysmenorrhea. This is a standard term used for pain and cramps. Hence, to summarize all of these, a female or a woman experiences pain twice in a month, right? What are the 2 times? First is your Mittelsmarsch, which takes place on the 14th day or the ovulation day, and the second is your dysmenorrhea. This takes place on your periods. So how will you differentiate this? This takes place on the day of ovulation and this takes place on the day of your periods. So this is the first time she experiences pain and this is the second time she experiences pain. Now let's talk about we all discussed about what would happen if ovulation takes place. Now, what will happen if no ovulation takes place, or there is no ovulation in our body? Now, what is this term called? This term is called anovulation. Okay, anovulation means there is no ovulation taking place in our body. Now, what will happen if there is no ovulation taking place in our body? See, if there is no ovulation, there will not be formation of prostaglandin in our body, right? Because it takes place when progesterones are released. They send signal to the brain, and the brain releases prostaglandin to does the contraction of the smooth muscles, right? So if there is no prostaglandin, then there will be decreased pain or dysmenorrhea. How? We knew prostaglandin does the contraction of the smooth muscles, right? If there is no prostaglandin, there will be no contraction of smooth muscles, which was the reason to cause pain and dysmenorrhea, right? If this does not happen, there will be no Mittelsmers. We knew that. Since there is no ovulation, there is no Mittelsmers. Simple. So the next topic that we shall discuss is types of dysmenorrhea. Right now we discussed what dysmenorrhea was, and now let's see what various types does it has. So the first one would be your primary or spasmodic. Now this takes place in normal women, or this is normal in every woman. Okay, normal woman, right? So what is this characteristic? It takes place 1 or half an hour prior, and this stays 10 hours past onset. Now what does this mean? This means that it takes place 1.5 hours before the start of your periods, and this will stay for another 10 hours, or this is your normal period cramps, right? Now the second one is the secondary or congestive dysmenorrhea. This is the pathological one. Okay, now what are the characteristics of this? This takes place 3 to 4 days prior to your periods. Okay, and this stays also for 10 hours past onset. Now this will be seen in some diseases like PID, that is pelvic inflammatory disease. Okay, and endometriosis. Okay, now the third one will be membranous dysmenorrhea. Okay, the third is the membranous. Now what are the characteristics of this? See, what happens when our body gets injured. So when our body gets injured, there is a clot formation which stops the blood from leaking from our body, right? So what takes place so that there is a clot formation? So our body has fibrins, right? Now this fibrins does the function of clotting the blood so that there is decreased blood loss from our body, right? Now, do you ever think why our blood is not clotting in our uterus or during the menstruation? Because see, our body has a tendency to clot the blood, right? Now, since there is no blood clotting in the uterus, what might be the reason? So let's discuss that. So our body has fibrinolysins. Okay, these fibrinolysins, they eat or destroy or damage the fibrins in the uterus, so there is no clot formation, right? so the blood is very watery or flowy. Now in this case what happens, there is decreased amount of fibrinolysins. Okay, now what will happen due to this? There will be clot formation. So if this is my uterus, right, there will be a clot in the same shape or the cast of the uterus. Now this is the clot. Now how do you think the clot will come out? Because the cervix is very small, right? It cannot let the clot pass from it. So women like this experience lots and lots of pain, because there will be lot of contraction of this uterus for the clot to pass and the cervix to dilate, right? But fortunately this is a very rare type of dysmenorrhea. This takes place very less. So how do you define this? Basically here we will see that the endometrium is shed like the cast of the uterus. Okay, now let's discuss the treatments. So what are some treatments of dysmenorrhea? First is the NSAIDs, right? You know this. These are the painkillers. These are given when a woman experiences a lot of pain during their periods or dysmenorrhea. So what are some of these? First is ibuprofen, then naproxen, then mefenamic acid. Now what will be the next one? Next one should be antispasmodic, right? So what are some of these? Some of it is hyoscine, orofavrine, and dicyclomine. So dicyclomine. The next you can prescribe is COCP. Now what is COCPs? These are combined oral contraceptive pills. What happened due to this? Now due to this your cycle becomes anovulatory. Now right now we discussed, if a cycle is anovulatory means there is no ovulation, right? If there is no ovulation, there is no Mittelsmarsch, right? And hence there is no pain. So this is a treatment. This will reduce pain, or there will be no pain in women after taking COCP. The next, or a very rare option, could be the dilation of your uterus. Dilation of uterus. This is a surgical procedure. Now what will happen is, so this was your uterus, okay, your cervix was very intact. Now due to the dilation or the surgical dilation, your cervix will be a little open. So the next time you experience period, the blood will be easily passed and you will experience a lot less or no pain. Or you could do presacral neurectomy, which means the ligation of the nerve, which sends signal for the pain. So if the nerve is ligated, there will be no signals to your brain that you are experiencing pain. Hence this is one of the treatment. Now our next topic would be some clinical terms that are related to dysmenorrhea or periods or menstruation. So firstly, let's discuss the length of the normal cycle. So what is the length of the normal cycle? It is 28 days, basically plus minus 7 days. Okay, so you can write that span around 21 to 35 days. Okay, so when a patient comes complaints about it. You know that 21 to 35, their periods, if the periods come between 21 to 35 days, it's normal, it's not irregular. Okay, now what will be the abnormalities? If it takes place less than 21 days, like the periods are very frequent, they get periods in 15 days or 20 days, then it is not normal, it is irregular. So what do we call this? This is known as polymenorrhea. I'm sorry, you have to memorize all of these. So less than 21 days is polymenorrhea. What will happen if this is more than 35 days? So their period is very irregular, they don't get periods for 1.5 months or 2 months. So you call it oligomenorrhea. Okay. Now this was the basic length. Okay. What is the duration of your period? So duration of normal period, okay, it is 2 to 7 days. This is normal. Now let's see what happens if it takes place or it has less than 2 days. So you have hypomenorrhea. Your periods last less than 2 days. Your periods come and go in 1 day or 1.5 day. Then it is not normal, it is hypomenorrhea. If your periods stay more than 7 days, then it is known as menorrhagia. Understand? So if your period stays more than 7 days, not normal. The normal range is only 2 to 7 days. Now the next factor would be amount of period. So what is the amount of a normal period, or how much blood should be discarded from the body? So 30 to 50 ml. What? 30 to 50 ml what? Per day or the whole cycle? If it is per day, the person is going to die very soon if it loses blood 30 to 50 ml per day. So this is for whole cycle. Okay? Don't be confused in exams. This is for whole cycle. A student like me would. Hence. So if you get periods or the amount of your periods is more than 80 ml, then it is irregular, or more than 50 ml, it's okay, this is irregular, right? So if your periods are less than 7 ml, if your periods are longer than 7 days and also more than 80 ml, then it is known as menorrhagia. Now you know that if a question comes that a person is experiencing periods for longer than 7 days, then obviously there will be more blood loss. So in both the scenarios, the person is experiencing from menorrhagia. Now if your periods are according to date, if your periods are less than 21 days, then you know what is the term here. We told it's polymenorrhea if your periods come in less than 21 days, but also it is more than 80 ml, right? So you have your periods less than 21 days very frequently, and the blood loss is also more. The blood loss is more than 80 ml. So what do we call it? We call it polymenorrhagia. Okay, here was the term polymenorrhea if it only has a period that is less than 21 days, but you also have blood loss more than 80 ml, so it will be known as polymenorrhagia. Okay, now the next is metorrhagia. Now what is metorrhagia? These are very frequently asked questions in your exams, so please try to memorize it. Now metorrhagia is intermenstrual cramp. What does this mean? Intermenstrual blood loss, or we also call this spotting. Now what does this mean? Like you have periods, you have a regular cycle or irregular cycle, I don't know. So you have periods on 10th of January and your next period date would be on 10th of February. You see a light spotting in between these dates, that might be on 23rd or 24th of January. Now this means that you're having intermenstrual blood loss. This will be known as metorrhagia. Now the next one would be menometorrhagia. I know this is very confusing. Now, what does menometorrhagia means? This means you have irregular as well as acyclic bleeding, right? So you have irregular periods as well as your bleeding is not cyclic, okay? So you bleed in between as well as spotting. The next would be amenorrhea. What is this? Now this is that if you are having no periods, right, for 6 months, so you have periods only twice a year, or you don't have periods for the next 3 regular periods, so you miss 3 regular periods, then you have amenorrhea. Okay, the next would be postmenopausal bleeding. What does this mean? This means that you are bleeding even after menopause. So how do we define this? If there is bleeding after 1 year, if a patient comes to you and they say that doctor, I've already I had menopause and then I'm bleeding after 6 months, then it is not postmenopausal bleeding. They might be experiencing amenorrhea. Okay, postmenopausal bleeding will only happen or you can only define this if there is bleeding after 1 year. So there is no bleeding in between. Okay, that's it. Now the next or our last term would be, this is important, okay, metropathia hemorrhagia. This is asked in exams. Okay, so what does this term means? This term means that you have prolonged amenorrhea which is followed by heavy withdrawal. So you know that there is amenorrhea means there is no bleeding for 6 months, but in this case you have prolonged amenorrhea. The span would be 8 to 10 weeks. You don't have your periods for 8 to 10 weeks, and this is followed by heavy bleeding. So you don't have periods for 8 to 10 weeks, and then when you have your periods, then there is a heavy bleeding or a lot of bleeding. Now this takes place in women who are more than 40 years. Okay, these are anovulatory and they are self-limiting. What does self-limiting means? This means they can be treated on their own. So a woman comes to you who is more than 40 years. She says that, doctor, I'm not having periods for 8 to 10 weeks, or I haven't had periods last month, right? And then the next time they have periods, they have a lot of heavy bleeding. So that does not mean that they are having postmenopausal bleeding. That is your metropathia hemorrhagia, okay? And it is self-limiting. It can be treated on its own, right? So yeah, that's it.